Look at that, I have a subscriber. Welcome guys. So for this Better Breathers Club meeting, we're talking about recognizing signs of an exacerbation and knowing when to call 911, which is really important because if you can recognize the signs early, you can get intervention early and then hopefully avoid a hospitalization, which is something we all want. So we have to start, right on cue. So we have to start with what is an exacerbation. And this is something I didn't realize until talking to people that, because in the medical world, we say an exacerbation is when you're admitted to the hospital. So we're saying you're having an exacerbation or inner exacerbation. That's just when we see you. The definition of an exacerbation is actually a sudden worsening of symptoms or a flare-up. So anytime that you're increasing your symptoms and you're using your inhaler more, you're more short of breath, you're coughing more mucus, we'll go into that. That's an exacerbation. And if you can catch an exacerbation early, that's the goal. So a little bit of statistics I found from a study done by the COPD Foundation in 2020. 36% of people with an exacerbation, with COPD, fear that reporting an exacerbation will put them in the hospital. So they don't report it because they don't want to go to the hospital. It doesn't mean it's not there. 34% worry that admitting that they're having an exacerbation means their COPD is getting worse. 29% say something as soon as their symptoms start to change. That say something to their healthcare provider. Only less than a third. 46% of people who wait, they wait to reach out only after they're sure something is wrong, which is understandable, but that's delaying care, right? And then among those who wait to check in about a problem, 60% of them don't feel that their symptoms are bad enough to say something. So a lot of times I hear patients say that they don't want to bother their healthcare practitioner. Like, it's not that bad. I'll just deal with it. I'll get through it. And that's like us as humans, right? If we say, I'll just get over it. It's fine. Just wait it out. But the longer you wait, there's a lot of stubborn people in this country. There's a lot of stubborn people in this state. There's a lot of stubborn people in this room. But only about 28% of people with COPD said that they know that once they have had a flare-up, they're more likely to get one in the future. So that means trying to prevent a flare-up is the best thing you could do, because the best indicator that you're going to have a COPD exacerbation is that you already had one. Oh, I did not know that. Put that on there. So early warning signs are more coughing, rapid breathing, difficulty sleeping, increased heart rate, sputum, color, thickness, amount, more fatigue or tiredness. I did not realize that these were all going to come out one at a time. New or more ankle swelling. So if you also have some heart-related issues, you can have some swelling in your ankles. If you have swelling, water is gravity dependent. So if you have swelling in your ankles, you're also probably going to have water in your lungs. Did you guys have a question?
No, we were just talking about what she had.
Oh yeah, but you notice some of these.
We noticed some of that stuff.
Yeah. So low-grade fever that doesn't go away, increased wheezing or chest tightness, morning headaches, dizzy spells, or restlessness. That could be a sign that your oxygen level is low, especially overnight, and needing your rescue inhaler more often. And then increased shortness of breath with doing normal activities. So normally you go to the bathroom and back, wherever you're in the chair or whatever, and it's not a big deal, but you notice like it's kind of harder for you to do so, or you're breathing a little harder. And oftentimes family members can see it before you can rationalize it. If you're the COPD person, you know how you're feeling, this happens sometimes, but family members are like, why are you breathing so hard? So family members are equally as important in catching these early signs. So early recognition, yeah? Yeah. There you go back here. Sorry, I have too many computers open. You had a question about the fluid in your lungs and the ankle swelling. Yeah. So that's just one of those signs. If you've got your ankles are swollen more than normal, like if they're always kind of a little bit swollen and you're on water pills and it's kind of maintaining, okay, but we're looking for a change. So if you're having more swollen ankles, that's something you should report right away. Yeah, and that's a really good point because post exacerbation, it's gonna take more time to get back to normal. It's when you have COPD, it takes longer to recover, so it's that slow process. So you're looking for a noticeable change in the wrong direction. You can always monitor your weight. You should be checking your weight on a scale every morning and keeping track of it because fluid is heavy, and so if you're increasing in your weight by a significant amount, I would say like a couple pounds a day, if you're trending in that direction, that's not fat, that's not muscle, that's fluid. You don't gain fat that fast. So yeah, do you take your vitals every day? Do you take? Some people do. Some people are really consistent. That's something that you can do if you have. It's really easy if you have like a smart scale, like with an app. You can just weigh yourself every day, and it logs it for you, and then you can go back and have that data. And those kinds of things are really good to show your healthcare practitioner because you can say, look, I was 110 pounds. Now I'm 12, 115, 100, you can see it go up. And that's going to show, okay, here we can see this trend. So we know that we need to increase some intervention. Yeah.
I think they told me more than 5 pounds a week.
Yeah, 5 pounds in a week is really good. Yeah. So, and if you're stable and you're normal and you're weighing yourself once a week and you notice that I'm 6 pounds, that's probably a really good indicator. If the everyday thing becomes daunting, once a week seems wasteful to me. Yeah, especially compared. Any other questions on this slide? Okay, so early recognition and early intervention. So when you're recognizing those signs from the previous slide, you're going to want to be continuing to take your maintenance medications. You don't want to stop your maintenance medications because they take a long time to build up, and then you get this nice, level built up in your system that you want to keep consistent. So don't stop taking your Breztri, don't stop taking your Trelegy, whatever you're on, keep going, even if you're sick. If you have an action plan that you have written with your doctor, that's when you want to start it now. And in those booklets, there is a magnet action plan that actually gives you like the green, yellow, red, what to do. You can take that to your provider and say, is there anything else I should be adding in the yellow zone or the red zone? And so that would be that specific action plan for your doctor. Increasing the frequency in taking your rescue inhaler, nebulizer medications. This might be something you're naturally doing because you're feeling more short of breath, so you're going to take your inhaler more often. Or put yourself on a regular schedule for that albuterol or levalbuterol rescue inhaler. But if you're short of breath and you're wheezing, you can go ahead and put yourself on a schedule, maybe doing it, 4 times a day, 3 times a day, whichever feels like it's giving you the relief. And if you're needing it more often than every 4 hours, that is a for sure sign. If that's not your normal and you're needing it more often than every 4 hours, or if you're taking it every 4 normally and you're cool, that's good. But if you're needing it more often than that, that is a sign that you need to get more help. If you're not improving and you're in this would be the yellow zone. If you're not improving after doing those little interventions, starting your yellow zone action plan and increasing your rescue inhaler or rescue medications, then you need to call your doctor, your primary doctor, your pulmonologist. They take sick calls over the phone And a lot of times they will prescribe you something, some intervention to try, or they'll give you some advice, go to the emergency room, or go get some labs done, get an x-ray, here's some prednisone, here's some zithromycin, something to kind of get you out of that exacerbation, yellow zone, and back to the green zone. You can go to urgent care in the yellow zone. They will also prescribe you those same medications. That's pretty standard for most people, and is that steroids and antibiotic to try to get you out of that. If your oxygen level is low, don't go to urgent care. If your oxygen level is low, below 90, just come to the emergency room. They're just going to tell you to come to the ER. So it would be a waste of your time to go to urgent care. Your doctor may prescribe an antibiotic, steroid taper to help you get through the exacerbation, x-rays, all that stuff. Okay, so preventing flare-ups, which is the golden thing we want to do. Hand hygiene, stopping the spread of bacteria, viruses. Hand sanitizer's good to keep around before you eat, after the bathroom, after you touch things like door handles, elevator buttons, all those kind of things. You want to make sure you're washing your hands. We are out of cold and flu season right now. It's typically September through March, but we have a lingering virus that's going around. We've got human metapneumovirus that's getting a lot of people right now, a lot. I'm pretty sure I had it 2 weeks ago. Parainfluenza usually hits in the summer. RSV can hit in the summer, and those are wicked cooties that can really get.
You should use your fingers to hit the You should be using
your tongue. Yeah, I know, but then a lot of people go. So, I know. People are people. People are people. Just wash your hands. Avoiding close contact with people who have colds or were diagnosed with respiratory infections, like coronavirus. Getting the flu shot, pneumonia shot. Flu shots every year. Pneumonia shot is typically every 5 years or so, depending on your doctor. The most recent one is the Pneumovax 21, I believe, and that one can be good for a little bit longer. So it really depends on your doctor's discretion of how often you should get the pneumonia vaccine. It's every 5 years or so. The RSV vaccination is one and done. So just get that, and once and you're good. Covers both strains of RSV. I didn't put on here the shingles vaccine is a really good idea, and Tdap, keeping up on that because pertussis is pretty common. You might have a question.
Yeah, the pneumonia vaccine.
Yeah,
I thought they said he was good forever.
Yeah, it depends on which one you get, and it depends on your doctor. So a lot of the times the doctors will say you're good to go as long as you have the Pneumovax 23 and the pneumococcal 13 or 15.
Yeah, I get 2 back to back.
Yeah, he probably got one of the pneumococcal and one of the polysaccharide variety. There's 2 kind of different ones. And getting both of those, you're good. Then there's a newer one, that's the Pneumovax 20. And I want to say, isn't there a 21 now?
I don't know about the 21. If that is, then it's like new.
I know there's a 21 because they wanted me to get it, and I was like, yeah. That's how it is.
You could just ask Sasso, do I need another pneumonia vaccine? And he'll let you know. He'll know. It's confusing and it's difficult because, especially the pneumonia vaccine, because if you go to the CDC website, which I think you just did for that handout that we have in there, you can take one. It's like, if this, then this, if this, then this, if this, then this. So it's very complicated for the pneumonia vaccine. So there's like a formula for people with their comorbidities. So just asking your doctor, next time you see your doctor, just say, am I up to date on all my vaccines? And they should be able, that's their job. They should be able to tell you, yes or no, you're missing this, you might consider this kind of thing. So just ask.
I went to the, my VA doc today,
Yeah,
and he gave me the pneumonia vaccine, and he said, I don't need to have it now.
Cool.
And I'm 82, so.
Yeah.
Yes, I'm gonna outlive it.
yeah, cool. Do you know which one you got?
You told me I was gonna outlive it, I don't care.
Yeah. I mean, it's the VA, so they probably got you with a blow dart, right? So, yeah. So it really depends on your risk factors of how often you should get it. Because I've seen some doctors say every 5 years for people who are really highly susceptible, and that might be people who are more immunocompromised. You know, if you have a suppressed immune system, they might want to kind of boost that up more frequently. But if your immune system is working relatively normally, then, you know, the rest of your life, that's killer.
Right now, it ain't no big thing.
Yeah, we'll take it. Yeah, that's great. That's great. Okay, always take your daily controller and maintenance medications, as your healthcare provider has talked to you about. Also know how to use them properly, because a lot of times, most of the time when somebody is having an exacerbation that's not caused by like a virus or something, you know, obvious, a lot of times what it is they're not using their rescue or their maintenance inhaler correctly, so they're not getting the medicine in that's helping to prevent these flare-ups. You know, I've seen people, I should have put it in here, but there's this like, in the RT world, there's this famous House clip, you know, the TV show House, where this girl comes in and she says, you know, I've been using this inhaler 6 times a day and it doesn't do anything. And he goes, well, show me how you're using it. She takes it and she shakes it and then she squirts it on her neck with perfume. And it's like, okay, that's not gonna do, I mean, it's a TV show, but it's like, that's not gonna do anything, right? So make sure you know how to use your inhaler properly. If you don't, ask me, I can help you for sure. And also there's a lot of resources on the last page, and there's videos and stuff where you can watch in case they change your inhaler around and you need to double check. Okay, so back to filling out your COPD action plan with your healthcare provider. So if there's anything specific they want you to do, sometimes the providers will, give you a standing prescription of prednisone or azithromycin, so you know, and they have in your action plan, when I'm starting to feel this way, I know I start my prednisone and I give them a call. And that's a really great relationship to have with your provider. And sometimes it just takes you asking for, hey, I want to be proactive, I want to have the tools available so that I can start them, you know, on a Saturday night, because that's when everything always happens, and then I can call you Monday and then we can figure it out.
That's how Sasso is for him.
Yeah.
Like he just had to do the prednisone taper thing again, and Sasso just wants us to send him a message on my chart.
Yes. Yeah. Let him know.
That's it.
Yeah, that's a great relationship to have with your provider. That's exactly how it should be. So, and then that's also a really good point is the MyChart messaging. They're very responsive to the MyChart messaging, because whenever they're doing their charting, it like pops up in the corner that they've got this little message, just like a text message. So it's easier for them to, you know, really quick reply to you or take care of it, rather than if you call the front desk, which is fine to do also, but if you call the front desk, they got to take the message, they got to relay it, then they got to remember to call you back, and it's, you know, it's the olden times. Use the technology that works faster.
And they
My chart only works correctly with certain doctors.
Yeah, that's true. It's a two-way street, huh?
Yeah.
Yeah. So
Some works fantastic with, and I got some that sucks.
yeah.
Because they don't even respond for 3 days, or 3 days already in the ER.
Yeah. If they're not responding, I would definitely call and bug them, because if you can make a couple phone calls, or your family member can make a couple phone calls to get the response that you need. I mean, if it's a holiday or a weekend and they're not there, whatever. But You know, if they're there during the week and they're not responding to you, bug them. It's fine. There's people that are, you know, there at the front desk answer the phone.
That's not a problem.
Okay, so if they have a specific action plan item for you to start, that's when you want to start early. So don't wait to see if the exacerbation or flare-up, how it's going. Don't wait for it to get bad. Call early to get the help you need. And then also just general support your immune system by getting regular exercising, pulmonary rehab. I think everybody in this room has been pulmonary rehab. Good nutrition with minimally processed whole foods. So that's like the perimeter of the grocery store. You want the whole foods, real vegetables, fruits, whole grains, lean proteins, healthy fats, minimal salt, or no salt, and water. Stay hydrated, because if you're dehydrated, your mucus is going to be thicker and stickier and harder to get out. If you're somebody who has to manage their fluid, like if you get swollen ankles, just making sure that you're balancing it. You know, there's too much of a good thing is not a good thing, right? So also managing your stress and prioritizing getting good sleep. Those are very important for your immune system. So here's the action plan. Ooh, blown up kind of ugly. So the green zone, yellow zone, and red zone. The green zone is where you're doing your regular activities. Your appetite's good, you're sleeping well, everything's normal. You can do all your regular things during the day without much problem. That's where we want to be. Keep taking your rescue medications, keep using your oxygen as prescribed, keep exercising. The yellow zone is when you're starting to have a bad day, have a flare-up, you're more short of breath, wheezy, all of those signs and symptoms that we saw before. Thicker mucus, different colored mucus, swelling in the ankles, coughing more than normal. Fatigue is a really big sign in the yellow zone, and it's a sign that a lot of people rationalize. They say, I just didn't sleep well last night. Well, why didn't you sleep well? Were you up all night coughing? Could you not lay flat because you've got fluid in your chest?
Or it's a sign of getting older.
Or is it a sign of getting older? But if you're up all night coughing and you're breathing hard at night and or you're working harder to breathe during the day than you normally do, you're going to be more fatigued. So that's a really big sign. And then the red zone, of course, is I need urgent medical care. So severe shortness of breath, even at rest, speaking in 1 to 2 word sentences. So that's when people have to take a breath between each couple words. Not normal. You're not doing you can't do any of your activities, you're not sleeping well, fever, shaking, confused, oxygen levels low, coughing up blood, chest pain. The red zone is when you call 911. So the yellow zone we went over in that last slide, this is when you start your rescue medication and you call your provider for early intervention. The red zone, now you just need to come in and see us. Come to the emergency room. Because you need a little bit extra help. So the red zone, call 911, go to the nearest emergency department. Do not drive yourself. Many people will just say, it's not that far, I'll just drive myself. Well, we have a lot of vehicle versus pedestrians in this valley. And some of them are no doubt because people drive themselves when they shouldn't be driving. So if your oxygen level is low, you are not getting enough blood to your brain to have those quick reflexes to make the community safe. So, and besides that, when you call 911, you get an ambulance that comes to you and they start the interventions right away. They start giving you, they put an IV in, they give you steroids in your IV, they put you on a BiPAP mask, they give you oxygen, whatever they're going to do, they start treating you while you're getting to the emergency room. So if they're there to save your life, and that's literally what these people want to do. So call them; they will be very happy to come and pick you up. While you're waiting to get to the emergency room, either by ambulance or if you're getting a ride from somebody else, keep taking your rescue medications every 20 minutes if you're wheezy or short of breath. When you get to the ER, we just hit you with back-to-back breathing treatments until you open up, and so you're getting that started. Whenever you get to the ER, we'll see you however you are, and we'll assess you and see what you need. But you're just starting the intervention early, so that way we're not playing catch up. And then follow any specific action plan item that you discussed with your provider. Okay, that was it for my presentation. So here's my contact info. I think all you guys have it anyway. But, and then if you wanted more information on this stuff, this blue one here is information from the American Lung Association. This orange one is from the COPD Foundation. They've got a lot of videos. They've got a lot of pages and pages of education that you can, if you have any other questions, or you can email me, call me. And I'll help you out. You're welcome. Any questions for anybody? All right, nothing online either. Man, I talk fast. Look at that. It's 1:27. All right, I'm gonna end this live stream. Bye, guys.
So what's the next 33 minutes about?